Are you a crappy partner, crappy wife, crappy husband, crappy mate? This podcast is for you. Give yourself the gift of self-awareness. Learn new skills. Take the time to assess your partnership, marriage, relationship, etc. So how are we going to do this? Start by taking the Crappy Mate quiz. The quiz can be found on our website, www.crappymate.com, on Pinterest, Crappy Mate, Instagram and Facebook, Crappy Mate Podcast. We will dedicate episodes to discussing the quiz topics. In further episodes, we will be exploring common problems, the speed bumps that occur in relationships. Also, we will introduce time-tested skills and helpful hints to enhance your relationship, and we invite you, our listeners, to contribute your thoughts, questions, or concerns regarding relationships. Welcome to the Crappy Mate Podcast. I'm Dr. Richard Vance Barnes, MD. I'm a board-certified general psychiatrist with 25 plus years in psychiatry. I have treated patients in a variety of settings, both inpatient units, outpatient units, partial hospitalization units, as well as detoxification programs and rehabilitation programs. And I've had a private practice for many, many years.
And I'm Barbara Quaid, a marriage and family therapist. I also have over 25 years experience working with families, individuals, and couples. And my life as a therapist has been both humbling and joyful. Before we get started, I'd just like to talk about our disclaimer. The Crappy Mate podcast is designed to be a useful tool to help individuals and couples have happier and healthier relationships. This podcast is not a substitute for individual or couples therapy, and as always, relationships need to be safe. Seek professional help as needed.
The Crappy Mate podcast was developed out of hearing years and years of stories and accounts from patients in therapy about their mates and themselves actually being crappy mates and poorly behaving within the relationship. And so this concept was then developed into a podcast of how can we help people to actually improve upon their relationships.
And so in order to do this, we developed a quiz. And the quiz, we really thought about some concepts that we thought were important in a relationship. And so the Crappy Mate quiz ended up being a 10-question self-scoring assessment that can be found on our Facebook page. And our Facebook page is aptly named the Crappy Mate Podcast. And along with the quiz, you will find a glossary with the terms we used both in the podcast and on the quiz. And this is so we can all be on the same page. Now, to score the quiz, you will read each question carefully and then ask yourself, do I do this almost always, sometimes, or almost never? And when we thought about this, the scoring is like this. Almost always is worth 3 points. Sometimes 2 points, and almost never 1 point. So once you have your total points, you add them up. And a score of 10 to 17 clearly indicates that one needs improvement. A score of 17 to 24, one has a degree of awareness, but improvement can still be beneficial. And a score of 24 to 30, one is aware, insightful, and acting in a positive manner as it pertains to the relationship. Welcome to the Crappy Mate podcast. In today's episode, we'll be talking about a very important topic, which is bipolar disorder. This will be part of a 2-part series. Part 1, we will describe the disorder, and in Part 2, we will talk about living with a partner, mate, spouse who lives with bipolar disorder. So, Dr. B, what is bipolar disorder?
Barbara, when I talk about bipolar disorder, I describe to my patients, it's a term that's been thrown around our society quite much today, and I think that most people would probably recognize it for the old term, which is manic depression or manic depressive disorder. But today, when I describe it to my patients, I talk about what it looks like. And for many patients, they may have been called bipolar because of their erratic behavior or their anger. But there are some really specific symptoms, some specific signs that I tell my patients that really truly identify one as being bipolar. And the first really important thing that I explain to them is that it's a biphasic disorder with depression being one phase. But the key defining symptom of bipolar disorder is the development of mania or a manic episode. And mania is a very extreme condition that is really quite serious. And when you're looking at mania, there are some key defining features that really identify one as being manic. And mania is an extreme condition that is really quite distinct. And usually people will have to be hospitalized. One of the key features that we see quite often is that they're not sleeping for several days at a time, or they're sleeping very little. They have this also in the manic phase. They have this extreme energy, and this energy is used to do goal-directed activities that really don't get a whole lot accomplished. But people will work and they will work at this thing. They'll work on a project with extreme energy, but again, they're not really getting much accomplished. Generally, in a manic episode, we will see grandiosity, and that's where people believe that they have these special, unique powers that other people don't have or possess. And I remember one of my first patients that I've ever treated, and I was actually just a medical student when I saw this patient. And it was a young man who was traveling across country, and what he was doing within his manic episode, and he was what we call decompensated. What he was doing was he was going from city to city, and he was developing what he believed a world rock tour. And he was hiring contractors, and he was trying to set up different venues. And this was something that he really had no knowledge of. He had no experience of doing. But during his manic episode, his manic phase, he believed that he was a world rock promoter and he could develop these concerts. It was only after his parents had discovered that they were getting bills from contractors, they discovered what he was actually doing. By that phase, he had come into light with the police. He was then hospitalized, and during his hospitalization is when I actually met him.
You know, Dr. Barnes, what you're describing is really, really serious. But what I hear in just everyday speech, you hear it at the malls, you hear it on television, is people describing, oh, she's so bipolar, he's so bipolar. And they are describing something that they think is a little off, but, they aren't really looking at the disorder seriously.
And I would agree with that. And unfortunately, the term bipolar has been tossed around, as I mentioned, in our society, almost like water today. It's everywhere. And we're using it interchangeably without really looking at the seriousness of the condition. It can be quite debilitating being bipolar, and certainly in the manic phase, and then also in the depression phase as well, where you're not getting anything accomplished. But it's a dramatic disorder, and it's really quite serious because of some of the things that we do see. And some of the features that really bring to mind the dangerousness is, for instance, the excessive involvement in dangerous activities. Now, I had a patient when I was working on the inpatient unit, whereby before her hospitalization, she had slept with 15 different partners before she was admitted. So clearly you can see the dangerousness of that situation. There have been several patients that I've treated that have gotten into trouble with the law because they've written bad checks. They're overspending. They're spending money that they don't really have. And so that they're writing bad checks and they're getting into trouble after that. Some of the other behaviors that you'll see with bipolar disorder, and especially in the manic phase. And as I mentioned, there's this increased goal directed activity, but they're not really getting anything accomplished. Much of anything, it's purposeless, but the patient doesn't recognize this, so they labor and they continue to labor at whatever it is they find to be of interest. Quite often, there's what we call a flight of ideas, with patients experiencing racing thoughts. It's almost like internally they have a TV changer in their head and they're going from topic to topic to topic to topic. And so they experience this as really a flight of ideas, but it's really racing thoughts. The thoughts are really racing. So the grandiosity is something that we mentioned as well. We talked about the pressured speech. Pressured speech is like you can't shut people up. They have to keep talking, and it has a real energy to their speech. There's a real pressure to their speech. So all of these behaviors that we will see in bipolar disorder in the manic phase, they're quite dramatic, and they can be quite devastating. And I think that when we're witnessing these symptoms, sometimes we just don't know what to do about it.
So is that what it's like when your partner is in the midst of this and they have a period of instability?
Yes, it is. And quite often they lack the insight that there's anything wrong with them. And so that makes it a very challenging disorder to treat. The other thing that makes bipolar disorder difficult at times to diagnose is the fact that people can have several years of and repeated episodes of just depression, the other phase of bipolar. Remember, the other phase of bipolar is depression. So they can have several periods of depression, not identifying and not recognizing the fact that they did have a manic episode at one point in time. And so the manic episode is the key feature that helps people to be identified as bipolar disorder, but it can present as depression for so many people for so many years. And so it is very challenging at times to realize that, yes, this is really bipolar disorder and not just a major depression.
So when does it really first occur? What age?
Well, we see bipolar disorder usually between the ages of 12 and 24. Now, my clinical experience is that I've seen most people really become manic and really get identified as having bipolar disorder, usually in the early 20s. And that's been my clinical experience. It's been the early 20s that most people that I've seen will then be labeled as bipolar and receive the diagnosis.
So we have some helpful hints for today. And our first helpful hint, as always, find out about bipolar disorder. Talk to your partner about what their experiences are. And in our next episode, we will have a longer list of helpful hints because that's when we will be describing what it's like to live with a person with bipolar disorder.
Well, thank you for that, Barbara. I think that it will be key for people to really help them to understand what they're watching and they're seeing in their partners. And perhaps the person who is diagnosed with bipolar disorder, this may be very, very helpful to them as well, because quite often there's not the insight into what they're doing and what they're experiencing. And in fact, most people like to feel the energy that comes from mania.
I hear that all the time in the therapy session.
Yes, very much so. But we have to remember, again, that it is a serious mental illness and it can have some devastating outcomes to the disorder.
Thank you for that.
In closing the podcast today, I just want to remind our listeners of our disclaimer. The Crappy Mate podcast is designed to be a useful tool to help individuals and couples have happier and healthier relationships. This podcast is not a substitute for individual or couples therapy. And as always, relationships need to be safe, Seek professional help as needed.
Thank you for listening to the Crappy Mate podcast. We invite you to submit comments, questions, and/or concerns about today's podcast, or give us feedback on relationship topics you'd like to hear covered. We encourage you to try our helpful hints. Give these a go, try them on for size. Remember, you can follow us on our Facebook and Instagram pages under the Crappy Mate podcast. Our website is www.crappymate.com, and please be sure to subscribe. Thank you for listening.